Hello, I'm Dr. Fox. Today, I'd like to talk about chorionic Villus sampling. Perinatal tests are carried out on your baby while she's still in your womb. They include amniocentesis and chorionic Villus sampling or CVS. So what is CVS? A specialist doctor takes a small piece of tissue from your placenta to check whether your baby has certain birth defects and genetic abnormalities or changes in the genes passed on by you or the baby's father. There are two kinds of CVS, transabdominal and transcervical. The doctor puts a very fine needle through your belly into the womb to take the tissue sample, and in the second, they put a tiny tube up through your vagina and cervix to take the sample. The sample is then sent to a laboratory for analysis. Then, you may wonder whether it hurts. Some women feel nothing and others feel cramping like period pains. Some women who have had the transcervical type test say it feels like having a cervical smear. You should take it easy for the rest of the day, and if any prolonged clamping or spotting or bleeding occurs, your temperature is high or feel contractions, call your healthcare workers straight away. Okay then, who should have CVS? CVS is offered to pregnant women whose babies are at increased risk of having a chromosomal abnormality. Your doctor will discuss with you whether you should have CVS and other perinatal tests, or you can ask them to arrange it. Women more at risk of having babies with a genetic abnormality are 35 or older, or have already had a baby or pregnancy with a birth defect. You can certainly consider CVS if your screening test results say abnormal, as CVS can give more information about the possible abnormality detected. Remember though that most cases of abnormal results go on to be healthy pregnancies and babies. You can also consider CVS if you or your partner or close relatives have certain genetic disorders, including cystic fibrosis or sickle cell anemia. Not every woman wants to have CVS, and talking to genetic and religious counselors, as well as trusted healthcare providers, can help you decide whether to have prenatal testing. Ask your healthcare providers to tell you about all the prenatal screening options so you are sure you are making the best decisions for you and your baby. Okay, question. Is it better to have CVS or amniocentesis? The advantage of CVS is that it can be carried out earlier on, between 10 and 13 weeks of pregnancy, so you and your partner have more time to make decisions. However, CVS is a riskier procedure, and unlike amniocentesis, it doesn't give information on neural tube defects like spina bifida. Then what are the risks of CVS? There is about a 1% risk of miscarriage, and other risks include infection and spotting or bleeding. The risks are higher with the transcervical method than the transabdominal one, and if the test is carried out too early in pregnancy, it can cause birth defects. Okay, next, what does the lab analysis show? In most cases, CVS test results show that a baby is healthy and without birth defect. If the test shows that your baby does have a birth defect, talk to your provider about all of your options. Your baby may be able to be treated with medicines or even surgery before birth, or there may be treatment or surgery he can have after birth. Knowing about the birth defects before birth may help you get ready emotionally to care for your baby. You also can plan your baby's birth with your healthcare provider. This way, your baby can get any special care she needs right after she is born. Lastly, what if you're not sure about having CVS? Choosing to have CVS is a personal decision. Talking with genetic counselors, your healthcare provider, and religious and spiritual leaders can help you make decisions about testing for birth defects during pregnancy. Ask your provider about other prenatal test options and how you can find a doctor who is trained and experienced in offering specific tests. Learn as much as you can about any prenatal test your provider recommends to make the right decisions for you and your baby. Okay, thank you for watching. See you soon.